Have you recently made the decision to quit smoking? If so, you're making a great choice for your health. And to prove it to you, we're going to show you the positive physical changes your body will experience after quitting the cigarette stick. But first, give yourself a pat on the back. Deciding to give up smoking takes a lot of willpower, and just making that decision already requires a lot from you. Plus, only a minority of smokers possess such an ability. So it's no surprise that cigarette smoking is the leading cause of avoidable fatalities in the world, especially in the United States. Can you believe that being a smoker means you get to inhale over 7,000 harmful chemicals? Just think about the profound impact this has on our vital organs. Fortunately, quitting the habit is enough to reverse some of the damage in your body that's due to smoking, and that's what we'll be sharing with you today. Keep watching to discover the changes that'll happen to your body after you stop smoking. But before that, please note that we are not medical professionals. What we'll be discussing is for educational purposes only. First, let's talk about the visible changes to your skin. When you smoke, it can cause your arteries to narrow and reduce blood flow. This means that your skin cells won't get enough oxygen and nutrients they need. And guess what happens next? Your skin loses its glow and wrinkles start to appear. Smoking can even make you look older. It'll cause you to get wrinkles around and under your eyes, making you appear more mature. What's more, unsightly yellow stains on the fingernails are a common sight for smokers. But don't worry, they usually fade away after you quit smoking. And that's not all. When you quit smoking, visible improvements on your skin happen, especially to your face, hands, and neck. Your skin and nails gradually regain their radiance and vitality. You also experience a boost in your immune system. Our immune system is usually pretty strong, but smoking really takes a toll on it, you know? When you smoke, it irritates your lungs and makes you more prone to respiratory illnesses like bronchitis and pneumonia. It's because smoking damages the cilia in your airways, which are responsible for clearing out mucus and other junk. When that happens, all these harmful substances and bacteria can build up in your lungs, causing respiratory infections and other health issues. But when you decide to quit smoking, your immune system starts to bounce back and get stronger pretty quickly. Why? As those cilia in your airways start to heal up, they can do their job again and clear out all that mucus and gunk. That means you're less likely to get respiratory infections, and your immune system can fight off those nasty pathogens that make you sick. Next, let's look at how quitting impacts the cardiovascular system. Smoking really does a number on your heart and blood vessels. It can cause long-term damage and increase your risk of atherosclerosis, which is when your arteries harden and become narrow because of plaque buildup. This means less oxygen-rich blood can get to your vital organs and body parts. So it's no surprise that smoking is a major risk factor for heart disease. Research even shows that smokers have a higher chance of having heart attacks and strokes. Even if you only smoke occasionally or are exposed to secondhand smoke, it can really mess with your cardiovascular health. In particular, it can cause serious damage to your heart and blood vessels. Quitting smoking comes with some great news. It actually reduces your risk of atherosclerosis and blood clots, lowers your chances of developing heart disease, and ultimately decreases your likelihood of dying from these ailments. What's more, Healthline.com reports that within 3 years of quitting, your risk of a heart attack will be the same as that of a non-smoker. But if you're already dealing with heart disease, quitting smoking not only reduces your risk of cardiac death, but also a second heart attack and dying due to other chronic diseases. Let's now take a look at how quitting smoking impacts your hair. Smoking not only affects the skin, but also has detrimental effects on the hair. Extensive research has demonstrated that the harmful chemicals found in cigarette smoke can contribute to hair loss. These chemicals disrupt the delicate balance of your hair follicles and impede their healthy growth. Additionally, smoking reduces blood circulation to the scalp, further compromising the nourishment and oxygen supply to the hair follicles. These combined factors ultimately lead to weakened and thinning hair. But when you make the decision to quit smoking, something amazing happens to your hair. As the harmful effects of smoking fade away, your hair follicles get a boost of nourishment due to better blood flow and finally getting essential nutrients. And guess what? Over time, your once dull and lifeless strands start to regain their natural fullness, shine, and thickness. Another thing to consider is the scent. Even fancy shampoos can't fully hide the lingering smell of cigarettes that tends to stick to smokers' hair. So if you quit smoking, you won't have that smoke smell in your hair anymore. Quick pause. If you're finding value here, hit subscribe and comment, "I subscribed," and we'll personally reply to thank you. Now let's look at the link between your reproductive health and smoking. Smoking really takes a toll on the reproductive systems of men. Research shows that it can seriously mess with sperm health, resulting in a lower sperm count. And it's not just men who suffer. Women who smoke often struggle with fertility and getting pregnant. And if they do manage to conceive, there's a higher risk of miscarriages and experiencing complications. And let's not forget about smoking's effect on their babies. Women who smoke during their pregnancy increase the chances of their child having all sorts of problems in their development, both before and after birth. But here's the good news. If you quit smoking, you give your reproductive system a chance to work its magic and lower your risk of infertility. That said, did you know that there's also a connection between smoking and breast cancer? There have been many studies that show a clear link between smoking and a higher risk of breast cancer. This risk is especially high for women who start smoking before having their first child. In fact, one extensive study found that female smokers are 61% more likely to have a breast cancer diagnosis compared to those who have never smoked. While we can't say for sure that smoking directly causes breast cancer, the evidence strongly suggests a strong connection between the two. Here's another organ that's impacted by smoking: your kidneys. Smoking actually affects the kidneys too, but not directly. It messes with how well medications work to control high blood pressure. And you know what? Uncontrolled hypertension can lead to kidney disease. So in other words, smoking can raise your blood pressure and put you at a higher risk for kidney problems. And remember how smoking lowers blood flow to organs? Yeah, that includes the kidneys. So smoking messes with how your kidneys work. It also messes with your oral health. It's important to note that people who smoke cigarettes are more likely to experience dental issues. These can include increased plaque and tartar buildup, bad breath, gum disease, stained teeth, loss of taste and smell, and a higher risk of oral cancer. The presence of tar and nicotine in cigarettes, in particular, can contribute to bad breath and teeth discoloration. Plus, more serious problems like gum disease and oral cancer are connected to reduced blood circulation caused by smoking. And you know what? Around 90% of individuals diagnosed with mouth or throat cancer have either used or currently use tobacco. When you quit smoking, it not only lowers your risk of oral cancer, but it also gives you fresher breath, boosts your senses, particularly smell and taste. There's less staining on your teeth, and you lower your chances of getting gum disease. So now let's dive into the impact of smoking on the nervous system. Nicotine is a seriously addictive compound that has a big impact on your nervous system. See, whenever you smoke, nicotine quickly gets to your brain and does two things. It amps you up, but also brings you down. That is, it acts not just as a stimulant, but also a depressant to your nervous system. Then, hormones like epinephrine and dopamine get released, which give you that short-lived pleasure and satisfaction you associate with lighting up a cigarette. But here's the thing. After that brief boost, you crash and feel tired. And guess what? That's when the craving for another cigarette kicks in, keeping the addiction cycle going. Speaking of addiction, smoking also affects your mental health. It's widely known that smoking can make you feel relaxed, giving you temporary stress relief. That's an appealing idea, right? And that's why it's so addictive. But in the long run, smoking just makes things worse. It intensifies tension, anxiety, and even increases your risk of depression. So you really have to ask yourself this question. Is that momentary boost really worth the lasting damage to your mental health? By quitting smoking, you can reduce stress, anxiety, and even improve your mental well-being. And when your mental health gets better, your whole life improves too. Finally, let's talk about the effects of smoking to the organ that's most directly impacted, which is your lungs. Smoking gradually leads to lung inflammation, which makes it harder to breathe. It also damages the tiny sacs in the lungs, or the alveoli, that help distribute oxygen throughout your body. But here's the good news. Quitting smoking can make a big difference to your lungs. In fact, research consistently shows that when you quit smoking, your lung capacity and breathing improve quickly. Even better? In just a few days of quitting, you'll notice that you can breathe easier. It's a sign that your respiratory health is getting better, and it's a great reason to quit smoking. Keep in mind that when you quit smoking, your lungs will start to clean themselves out, so you might cough more for a little while. But that's just your body getting rid of the pollution from smoking. It's a good thing. And now, let's explore some of the best ways for smokers to naturally detox their lungs at home. Click on this video now to find out.